Welcome to our channel. Today, we're diving into the essential topic of tooth extraction. Whether you're facing this procedure or just curious, we've got you covered. Now, I know what you might be thinking. Tooth extraction? That sounds intense. And you know what? You're right, it's not exactly a walk in the park. But here's the thing, it's a common procedure, and understanding why it's sometimes necessary can make all the difference. So if you're ready to become a bit more tooth savvy, stick around. We'll explore the reasons behind tooth extraction, what to expect, and how to care for your smile afterward. Let's get started. All right, let's talk about one of the most common reasons for tooth extraction, severe tooth decay or damage. You see, our teeth are incredibly strong, but they're not invincible. Over time, things like sugary drinks, poor oral hygiene, and even genetics can take their toll. When a tooth is severely decayed, it means that bacteria have eaten away at its enamel and dentin, those hard outer layers that protect it. This can create deep cavities, making the tooth weak and susceptible to further damage. Now, in many cases, we can save a tooth with a filling or a crown, but sometimes the damage is just too extensive. Imagine a house with crumbling walls and a shaky foundation. You can only patch it up so much before it becomes unsafe. The same goes for teeth. If the decay is so severe that it's reached the inner pulp of the tooth, where the nerves and blood vessels live, it can lead to some serious pain and infection. And trust me, you don't want to mess around with a tooth infection. It can spread to other parts of your mouth and even your body. That's why in these cases, extraction becomes the safest and most effective option. Think of it as removing a bad apple from a bunch. It's better to address the problem head-on than risk further complications down the line. So if you're experiencing persistent tooth pain, sensitivity, or notice any discoloration or swelling in your gums, don't hesitate to see your dentist. Early detection is key, and it could mean the difference between saving your tooth and needing an extraction. Let's talk about gum health, or more specifically, periodontal disease. You see, our gums aren't just there for aesthetics, they play a crucial role in supporting our teeth. Think of them as the foundation of a house. Without a strong foundation, the entire structure is at risk. Now, periodontal disease, also known as gum disease, is an infection that affects the gums and the bone that supports our teeth. It's often caused by a buildup of plaque and tartar, that sticky film that forms on our teeth. If not removed regularly through brushing and flossing, it can irritate the gums, leading to inflammation and infection. In its early stages, gum disease, known as gingivitis, might cause symptoms like red, swollen gums that bleed easily, especially when brushing or flossing. However, if left untreated, gingivitis can progress to periodontitis, a more serious form of gum disease. In periodontitis, the infection spreads deeper, damaging the tissues and bone that hold teeth in place. As the disease advances, the gums may pull away from the teeth, forming pockets that can become infected. The bone and supporting tissues can deteriorate, causing teeth to loosen and eventually require extraction. Now, here's the thing about gum disease. It's often painless in its early stages, which is why regular dental checkups are crucial. Your dentist can detect the early signs of gum disease and provide appropriate treatment to prevent further damage. Let's talk about impacted teeth, those troublemakers that just can't seem to break through the gums properly. You know, the ones that often cause a lot of discomfort, especially those pesky wisdom teeth. Now, an impacted tooth occurs when a tooth is stuck beneath the gums, either partially or completely. This can happen for a number of reasons, like insufficient space in the jaw, the tooth erupting at an angle, or even just plain old bad luck. Wisdom teeth, those molars that typically emerge in late adolescence or early adulthood, are notorious for becoming impacted. Why? Well, often there's simply not enough room in the jaw to accommodate them, leading to a whole lot of crowding and discomfort. Now, an impacted tooth might not always cause noticeable symptoms, especially in its early stages. But as the tooth tries to push through the gums, it can lead to pain, swelling, tenderness in the gums, and even difficulty opening your mouth fully. In some cases, an impacted tooth can also increase the risk of infection. You see, the flap of gum tissue covering the partially erupted tooth can create a breeding ground for bacteria, leading to a condition called pericoronitis. Pericoronitis can cause pain, swelling, and even pus discharge around the affected area. Not exactly a recipe for a happy mouth, right? That's why, if you suspect you have an impacted tooth, it's essential to see your dentist. Chapter 4. Overcrowded Mouth. Let's talk about overcrowding, a common dental issue that can have a big impact on your oral health and the alignment of your teeth. You see, our mouths are like perfectly designed puzzles, with each tooth having its designated spot. But sometimes, there's just not enough room for all those teeth to fit comfortably, leading to a condition called overcrowding. Imagine trying to squeeze too many people into a small elevator. It's going to be a tight and uncomfortable fit. Overcrowding can occur for a number of reasons, such as genetics, habits like thumb sucking in childhood, or even late loss of baby teeth. When teeth are crowded, they can overlap, twist, or even rotate out of position, creating a less than ideal bite. Now you might be thinking, so what if my teeth are a little crooked? It's just aesthetics, right? Well, not quite. While a straight smile is certainly aesthetically pleasing, overcrowding can have implications beyond just appearances. When teeth are crowded, it becomes much harder to clean effectively. Those tight spaces between teeth can trap food particles and plaque, increasing the risk of tooth decay, gum disease, and bad breath. Overcrowding can also put excessive pressure on certain teeth, leading to wear and tear, chipped teeth, and even jaw pain or headaches. In some cases, it can even affect speech and chewing ability. Chapter 5: Orthodontic Treatment. Let's talk about orthodontic treatment. You know, those braces and aligners that work wonders in straightening teeth and creating beautiful smiles. But here's the thing. Sometimes achieving that picture-perfect grin might require a little more than just shifting teeth around. In some cases, tooth extraction might be recommended as part of the orthodontic treatment plan. Now, I know what you're thinking. Wait, you're going to pull out perfectly healthy teeth just to make space? Well, it's not as scary as it sounds. Let me explain. When teeth are severely crowded or misaligned, there might simply not be enough room to move them into their ideal positions without creating other problems. Think of it like rearranging furniture in a room. Sometimes, to make space for a new sofa, you might need to get rid of an old armchair that's taking up valuable space. Similarly, extracting certain teeth, often premolars, can create the necessary space for the remaining teeth to shift and align properly. This allows for a more harmonious bite, improved oral health, and of course, a straighter smile. Now, the decision to extract teeth for orthodontic purposes is not taken lightly. Your orthodontist will carefully evaluate your individual case, considering factors like the severity of crowding, your bite, facial profile, and overall treatment goals. Chapter 6: Infection. Let's talk about infection, a serious dental concern that can sometimes lead to tooth extraction. You see, inside each of our teeth lies a vital structure called the pulp. It's the innermost part of the tooth, containing nerves, blood vessels, and connective tissues. Now, when a tooth is healthy, the pulp is well protected by the surrounding enamel and dentin layers. But when a tooth is severely decayed, fractured, or damaged, it can create a pathway for bacteria to enter the pulp, leading to infection. This infection, known as pulpitis, can cause intense pain, sensitivity to hot or cold temperatures, swelling in the gums, and even fever or swollen lymph nodes in some cases. It's like a fire alarm going off in your tooth, signaling that something is seriously wrong. Now, in its early stages, pulpitis might be reversible with a root canal treatment. This procedure involves removing the infected pulp, cleaning and disinfecting the inside of the tooth, and then sealing it to prevent further infection. However, if the infection is severe, has spread to the surrounding bone, or if the tooth is too damaged to be saved, extraction might be the best course of action. Think of it as removing a weed from your garden. If you leave the roots intact, the weed is likely to grow back. Similarly, if an infected tooth is not addressed, the infection can spread, leading to more serious complications. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more informative content. Remember, while we've covered some common reasons for tooth extraction, it's essential to consult with your dentist for personalized advice and treatment options. They're your partners in maintaining a healthy and happy smile. See you next time.